And as we start to move down this pathway, there are a couple of regulations that are beginning to evolve and to roll out, and I just wanted to highlight a couple of those during our opportunity today. The first of which is that the 2019 risk adjustment model that has some updates as it relates to additional conditions being included. So mental health, substance use disorder, chronic kidney disease, these are all being added to the risk adjustment model, and I think folks are really, we'll see the benefit of that because obviously these are really predominant in the populations and certainly very important and critical areas for assessing risk. In addition to that, the number of conditions that any individual beneficiary may have, as well as some different technical updates in terms of the overall accounting in the model is going to be taking place for the 2019 year. We see some changes as well in terms of the overall use of encounter data. This, of course, is expected, and that trend has moved now from 15% of encounter data in fee-for-service diagnosis against the 85% RAPS and fee-for-service diagnosis. We'll see that go up in the performance year of 2019, 25% encounter data and 75% RAPS. So we're beginning to see that transition. It's well underway, and I think most folks have been preparing accordingly. As it relates to STARS measures, again, some changes to the STARS measures. We're seeing a statin use in persons with diabetes, statin therapy for patients with cardiovascular disease are new measures. There's certainly always, of course, updates and removals to those, but highlighting those two areas as notable. And I think finally the 3-year phase-in. So all of these different activities now must be phased in over a 3-year period beginning with 2019. So any changes that are underway need to be fully implemented for 2022 and subsequent years. And so again, lots of activity to make sure all these things are ticked and tied within organizations, but being mindful that this is a continually iterative landscape for all of us who play in it. And just, of course, April 2nd of 2018 to highlight will be the new capitation rules and final payment policy announcements that are coming forward.